All right, thank you. Here the program still this morning on ITV on Independent Television. We have Dr. Uwa Okwarobo here, who is the Assistant Incident Manager on COVID-19 to the Edo State Government. You're welcome to this program.
Good morning. Thanks for having me.
All right, viewers out there. Yesterday we saw the final reception of the COVID-19 into the country by the Presidential Task Force on COVID-19 and also some key members of the Federal Ministry of Health, particularly the Minister of Health himself, but, also there receiving the COVID-19 vaccine. And it's something that a lot of people have expected into the country. It is the largest and the third release by AstraZeneca by COVAX initiative, trying to help nations of the world that cannot provide and of course procure the COVID-19 vaccine. And the AstraZeneca, that's the COVID-19 vaccine that has been received in Nigeria. We're told that it's going to go down to all the states of the Federation. And we also understand that the National Primary Health Development Agency is also going to help in assisting to make sure that it gets to the nook and cranny of Nigeria population. But one big question that comes to mind is that in a population of over 200 million, what is 3.9 million doses of vaccine going to do? Well, we understand that this is the first trench, that all the trenches are going to come as we get along. Doctor, you are welcome one more time.
Thank you very much.
I'm sure you had a sigh of relief yesterday when we had this COVID-19 vaccine coming into the country. But give us more insight, because we're receiving so many stories and of course reading so many literature. Some say that the AstraZeneca vaccine is cheap. There's no doubt about that. And some also say that it's less effective when it comes to the COVID-19, most especially for the B.1.1 variant that we also have in Nigeria now. Now, what is the true position of the AstraZeneca COVID-19 vaccine as it relates to the COVID-19 itself, most especially as it also relates to the B.1.1.7 variants of the COVID-19?
Okay, thank you very much. As you said, it was a sigh of relief, seeing our own tranche of vaccines received in the country yesterday. I think we are beginning to see the light at the end of the tunnel by the grace of God. So as regards, the issue of AstraZeneca vaccine, you are aware that not only AstraZeneca vaccine has been pulled out across the world, but for Africa, AstraZeneca vaccine, has been shown to have, in terms of adaptation to all the logistic facilities we have in the country. Then as regards the potency and how it works, whether it's going to be effective or not, I can assure you from research that has been carried out on AstraZeneca vaccine, it has a very high potency and is very effective to produce immunity for everyone that is going to take it. It's going to be in 2 doses and in six weeks apart, and it's going to provide over 95% immunity for any individual that takes both doses. Mind you, the first dose is just to prime the system, and the second dose will ultimately give, the larger percentage of immunity that an individual needs. So AstraZeneca vaccine is very potent. There is no doubt about it. Research has proven it to be so. And I want to advise members of the public to receive this vaccine when it comes according to the phases that we are going to prioritize.
Okay. Now, we do not know who exactly is going to be taking this vaccine. What I mean is that though the Federal Minister of Health has warned yesterday that anybody below 18 should not be considered for vaccination at all. Just like most other, vaccination, it's some certain age that you have to take it. But if you check the record, only yesterday about over 150,000 Nigerians, are down with the COVID-19. Who takes this vaccine? Is it the person that is infected already, or the person that needs some form of immunization against the vaccine? Who takes the vaccine?
Thank you. The vaccine rollout plan has been, scheduled already. It's going to be in phases. The first phase, according to prioritization with our epidemiological data, is to be given to the frontline health workers and support staff, as well as strategic leaders. These form 1% of the population. So the close to 4 million vaccines that were received yesterday are specifically for this first phase of vaccination, which will involve frontline health workers across the country and support staff, as well as strategic leaders. When I mean strategic leaders, politicians and top government functionaries, which will also going to help to boost acceptance and reliability for the vaccination as we progress in it.
Okay. Now, some also say that the number that we have, 3.94 million doses, is a far cry, considering a population of people of over 200 million. And you also said that you need to take it up to about 2 times.
Yes, 2 doses.
2 doses.
Yes.
You have to take the first one to prime the system, then you take another one so as to get the effective immunity against the virus. But the way things are done here, what is the guarantee that we're going to have, a quick, another trench coming into the country so that people can easily do a follow-up?
Yeah, there's no doubt about that. All countries in the world are highly expectant of, vaccinating at least 70% of their population.
Yeah.
Okay, so for Nigeria, this is just the first, tranche of vaccines to be released. We're expecting more, and plans have been rolled out already. Now, the plans started even late last year, and so there is no doubt about that. The Federal Ministry of Health and PCDA, they are on top of their game. So just like 2 other countries received theirs before us, we are before the end of this month, we're going to get clear details as regards when the next vaccine, a tranche of vaccine is going to be pulled out to Nigeria again. So it's going to be in phases. There's no doubt about that. We are going to have all the vaccines that we need to vaccinate 70% of our population in order to get herd immunity. Herd immunity in the sense that that is going to give us the assurance that there is no transmission of the virus from one person to another. That if we can get the target of 70% of the Nigerian population, which is about 120 million thereabout, 120 million to 140 million thereabout. And so we will require a lot, about 240 million doses of the vaccine to achieve this wonderful height. So I think MPCDA are doing all they can, and in collaboration with international partners. COVAX, with their magnanimity, has given us, this first tranche, and they are going to support us to, vaccinate 20% of our population. And then the other 50%, which will make up 70%, the Nigerian government, in collaboration with other international organizations, putting all machineries in motion to ensure that we achieve this height.
Okay. Now, you are the Assistant Incident Manager on COVID-19 to the Edo State government. Let's see the modalities that have been put on ground now by the Edo State government, because with effect from today, we understand that through the Federal Ministry of Health, in collaboration with the National Primary Health Development Agencies, are going to start giving states down to local governments and down to wards. Now, what are the modalities, preparations on ground in Edo State to show that Edo State government is ready for this vaccination?
Yes. As you are already aware, the state governor, Mr. Godwin Obaseki, is a very proactive governor. In fact, before the rollout plan, we have already started discussions. If you recall, the last time I was here, I talked about some basic things we're already doing on our own part. We have the Edo State Primary Healthcare Development Agency, which is the state's arm of the National Primary Healthcare Development Agency. It's statutorily responsible for ensuring that every person that needs to be vaccinated gets vaccinated as at when due. So we have done the TOT training, national TOT training. We're also going to cascade that training.
With enough personnel?
Yes, enough personnel. We have, Edo State prides itself as one of the best states in terms of routine immunization. And we thank God that this AstraZeneca vaccine is, amenable to all our logistic facilities because it's stored, from +2 to +8 degrees centigrade, which we use in our routine immunization schedule in Edo State and Nigeria at large. So all machineries are there, the personnel are there. They are all in the various local government areas. And before the end of this week, we are going to, do the training, cascade the training that we already had from the national, because we had a national training of trainers, cascade the training to the ward level and to the health facility level to ensure that everybody that is going to be in the field will understand what exactly this vaccine is, how it is administered, what and how and where in terms of all the logistics that's going to be rolled out will be fully, given to this set of officers who are readily available and waiting anxiously because this is, a time in our history that we can never forget. And everybody who plays any part in this activity is going to find it worthwhile. Okay.
Now, the preservation is supposed to be in form of cold chain. There's a central, storage, preservation, place, location. Then it moves to local government and onward to wards. Now, for some people, they really don't express confidence. Take, for example, you take this vaccine down to somewhere like Ogbese, where you don't have electrification. How do we preserve such, vaccines there?
Yes, what is done as soon as, because from on the 8th, the vaccines are going to be moved to the various states. So as soon as we receive the vaccine, we receive them into our state cold chain facility, which is optimal and very functional. What is done is these vaccines are sent to the various local government areas, which have optimal facility for storage.
And from there to wards?
And from there, the officers that have been trained come daily to pick the quantity of vaccines that will be used for that particular day.
Okay.
And these vaccines are kept in, geostyle boxes, cold boxes that will preserve their potency until, the vaccines are administered to the clients wherever they are. Okay. And there is enough, logistic facilities for that already as I speak.
Now let's talk about the way people are going to be reacting to this vaccination. I remember the last popular vaccination that was done, the polio vaccination. A lot of people, at the point, a lot of people didn't want to come out. I mean, so many mites and myths, stories and all that. So what is the guarantee this time that Nigerians may want to accept these vaccines? Because they read a whole lot of information. Some say that the same vaccine that was rejected in South Africa has been brought to Nigeria. They are not going to take it and all that. So how do we go through all this?
Yeah, there's a lot of myths around, the vaccination. So we've expected this long ago, and that's why we have put in all machineries in motion to ensure we intensify risk communication activities through our risk communication pillar in the EOC, Emergency Operations Center. So we are very hopeful that before the end of this week, the messages, key messages that people need to understand about the vaccine and how it's going to be rolled out in Edo State will be fully open to members of the public through our various media channels, including ITV. Everybody going to know about this vaccine and how it's going to be rolled out in terms of the phases. Also in terms of acceptability, that's why I mentioned earlier that key top government functionaries are very, very important in this aspect, because imagine seeing Mr. President or Mr. Governor taking the vaccine on live television program. That improves the acceptability across the nation, across the state. So there is no doubt about that. The fears of people is going to be doused as soon as the vaccines are rolled out in the country and across the states.
Okay, then the vacilators, they are being trained now?
Of course,
yes. Okay, across the state too?
Across the states.
Okay, all right, now let's look at the way the COVID-19 result has, there seems to be a surge. In the past few days now, even in Edo State, we had numbers going up and all that. What is going on?
Well, actually, it's not really been a surge. If you study the pattern, there is a gradual decline for the past 3 weeks. There's a gradual, steady decline, not even only in Nigeria or the states, across the world. There's a gradual decline. It's not totally understood yet, but what we can explain is that it's a trend that does not only pertains to Edo State or Nigeria, it's globally. So we are still studying it and seeing how it goes. Perhaps the vaccination that has started across the Western world perhaps is beginning to show some effect already, but we cannot totally explain exactly why there is that kind of downward trend. Just last night we had 17 confirmed cases of COVID in Edo State. 48 hours ago we had 34. So it's a bit unsteady currently, but we are still studying it and saying that perhaps we may be beginning to plateau as a state or as a country, but we are not yet there yet. COVID-19 is still very much with us, and we must still continue to imbibe all the non-pharmaceutical interventions, including wearing of face masks, social distancing, use of hand sanitizer, washing your hands frequently, and ensuring you avoid crowded places.
Okay, now that the vaccination is about to start in the country, some persons, are most of the opinion that we need not to do tests anymore. I mean, let everybody be vaccinated so that everybody can be protected. What's your take on that?
No, we're not going to rest on our hands in terms of scaling up of sample collection and testing. In fact, that is the way to go. Continuous testing and vaccination is like a double-edged sword in this regard. So we are not saying...
If you vaccinate,
yes.
If you vaccinate, do you still have to test?
Of course.
What are you testing for?
Because we want to see if the virus is still in the population and continue
let's get something straight.
All right.
This, the AstraZeneca vaccine, is it effective against the COVID-19?
It is preventive.
It is preventive.
It's not therapeutic or curative.
Okay, so if I take the vaccine, do I need to go for a test? If
you have symptoms that suggest COVID, you must go for a test.
After taking the vaccine?
Of course, because it's not therapeutic. It's not therapeutic. If you know the measles vaccine, children take the measles vaccine. However, some children still come down with measles. But if you are very close, to a pediatric clinic, you will discover that children who have been immunized against measles, that come down with measles eventually, do not have the full-blown measles.
Okay, so what we are saying is that if I get vaccinated against the COVID-19, there's still tendency that I might still contract the COVID-19. That's what you're saying? Of course,
but not as if you didn't take it at all. So you might come down with it, you might get infected, but you will not come down with a full-blown disease.
Then what is now the use of the vaccination?
So what we are saying is vaccination is going to prevent, infection.
Yeah,
it's not therapeutic. Just as I explained as regards the measles vaccine, it's preventive, but that does not mean the child will not come down with measles. You understand? So coming down with measles as a child with measles is not going to be as, when the child didn't take the vaccine at all. And we have seen this clearly in most of our clinical cases for measles. And the same explanation goes for, the COVID as well.
Yeah, the reason why I'm asking this is a lot of people are already of the mindset that the COVID-19 vaccine does not actually cure. It prevents you from getting, contacted, from you contacting the vaccine.
Of course, vaccination is not curative. It prepares the body. It's like the body gets the soldiers that fight diseases for COVID. I mean, for COVID right now, when you take the vaccine, the body gets the antibodies prepared so that in case the person is exposed to the virus, the soldiers, as it were, in the body that protect against the COVID comes up to fight the COVID. And even if the person comes down with the disease, it's not as full-blown as when the person did not have.
So it then now means that if I get vaccinated, I may still have to stay observe.
Of course,
the
exactly.
protocols.
You must continue the non-pharmaceutical protocols and interventions. Like I mentioned earlier, you must continue to wear your face mask, use your sanitizer.
Even after the vaccination?
Exactly, yes. So it has come to stay with us. That's what it means.
Okay. Now, it appears this is somehow, can we say with what you are explaining now, is it for the AstraZeneca vaccine alone? Or because some persons are saying that the AstraZeneca is less effective, that the Pfizer vaccine that we got to know that at a point Nigeria was about bringing it, but maybe because of cost and all that, the federal government rejected that and all that. So if we had had the Pfizer vaccine, would we have been going through all what you're trying to?
Of course, it's the same process. The Pfizer vaccine, the storage system is not amenable to our own logistic facilities here in Nigeria. The storage system is between -60 to -80 degrees centigrade.
Now we don't have enough
and we don't
power.
have such facilities.
Okay.
However, that does not make AstraZeneca vaccine, less potent because of the storage system. AstraZeneca vaccine is as potent as the Pfizer vaccine.
Okay.
Yes. The only difference is it's stored at +2 to +8 degrees centigrade, which we have the facilities across the country.
Okay. Now let's come back to Edo State now. Frontline health workers, doctors, nurses are going to be the first people that these vaccines are going to be administered to. So your colleagues, are they ready to take these vaccines now?
Yeah, no, we are currently sensitizing all our clinicians across the states. We are, because you still find some persons who still do not believe, even as clinicians, that, this vaccine is potent or is going to be acceptable. Some say they will not even take the vaccine.
Even as clinicians?
Of course, we still find some persons like that. So we still continue our sensitizations concerning clinicians and other members of, the health system in the states to ensure that every health worker is protected. And the Nigerian Medical Association is also at the top of its game in that regard to ensure that every health worker, not only doctors now, are protected by taking this vaccine as soon as it comes.
Okay. Now, just like what we always do, I like the viewers out there to hear from you as you look into that camera and you talk to viewers out there. We have the vaccines already in Nigeria now, and any moment from now it's going to be a public thing so that people will get one or two information from your doctor.
Thank you very much. I want to assure the good people of Edo State that these vaccines are potent, they are safe, and they should be accepted by everyone that is eligible to take this vaccine. The vaccine is not a substitute for the non-pharmaceutical interventions that we already know, including washing of your hands or use of hand sanitizers, social distancing, and ensuring that you avoid closed places. We must continue to adhere to these non-pharmaceutical interventions because it's going to take 2 years to even vaccinate the 70% of our population to get the herd immunity I talked about. So let's continue to practice and adhere to all the non-pharmaceutical interventions while we remain hopeful that all those who are eligible to be vaccinated in the state will get vaccinated according to the phases that have been rolled out already. So from the 8th of this month, we're going to be expecting the health workers, frontline health workers.
From the 8th of this month?
Yes,
that's
from the
about
8th.
Next
yes,
week. Okay.
yes. We're going to receive the vaccines and then...
In Edo State?
In Edo State, we're going to receive the vaccines, and then all health workers who are eligible in terms of the percentage that has been located to Edo State will be vaccinated, and then we'll go to other phases. The second phase involves those that are 50 years and above, because from our data, we discovered that these persons are more vulnerable to the virus. And then the third phase are those 18 to 59 years with comorbidities, because we also know that comorbidities, for those with comorbidities or underlying sicknesses, are also vulnerable to, this virus. And then the last, which is the fourth phase, are all other persons who are eligible to accept.
All right, thank you so much, Dr. Waparabo, who is the Assistant Incident Manager on COVID-19 to the Edo State government. And he just said that on the 8th of this month, Edo State is going to be having its own share of the 3.94 million doses that has arrived into the country yesterday. So let's keep our tabs and see how the Edo State government, he has said that the Edo State government is so ready to make sure that they vaccinate those that are vaccinatable. That's the word now. All right, thank you so much, Dr. Warbo.
My pleasure.
Time
thank you for having me.
More segments on this program this morning on ITV. Please stay tuned.